Hi, my name is Karen Smelser, and I'm here to help present this disease, necrotizing fasciitis. So my portion of this presentation will be to give you the etiology of this disease or the cause of this disease. And so the cause of this disease is a microorganism or bacteria called Streptococcus pyogenes. And so to talk about this bacteria first, we'll talk about the morphology of it. And so that's already in the name, Streptococcus. Strepto meaning chain and coccus meaning round. So it's a bacteria that's round and all chained together. And so it's pretty simple to understand. Now I'll talk to you about the gram stain and the cell envelope. And so there's two gram stains that we talked about in class, right? Which is gram positive and gram negative. Now this is gram positive, and so there's only two layers that make up the cell envelope. And so the layers will be like the cell wall, which is there to help withstand the osmotic pressure that's put on the bacteria, and that is composed of peptidoglycan, which is sugars, NAM and NAG, and also amino acids. And we talked about that in class, and we covered that in class and how they're cross-linked and all of that. Also, there are acetic polysaccharide chains that help with the rigidity of the cell wall. And after the cell wall, there is the plasma membrane, which consists of a phospholipid bilayer that has proteins in it to help the bacteria out as well. Now we just talked about some of the structure of the bacteria. So there's a few other things that we would like to discuss with you about it. The first one is the capsules. And so the capsules are there, and they're made up of hyaluronic acid, and protects the bacteria from being destroyed by the neutrophils. And so if a neutrophil tries to come destroy it, it releases this acid and kind of surrounds this bacteria to help get rid of the neutrophil. Also, there's no endospores that come with this bacteria, and so we don't really have to worry about that. Next is the M protein. So Streptococcus pyogenes has M protein, which helps them overthrow the defenses of the host cell, so that this bacteria can enter the host cell. And so, with that being said, there's also something called a pyogenic or ethrogenic toxin, which helps activate T cells and produces an inflammatory response. So this is like the cause of the rash of scarlet fever that bacteria cause. And so that takes care of the etiology of this bacteria, but there's more to come that we would like to share with you.
Necrotizing fasciitis is caused by one or more bacteria that attacks the skin, the tissue just beneath the skin, the subcutaneous tissue, and the fascia, causing these tissues to die. Necrosis. NF is more susceptible in those whose health is poor, like those who are obese, have a chronic disease, untreated diabetes, chronic kidney failure, and alcohol abuse. However, everybody is susceptible to NF. There are a couple of ways someone can contract NF. Type 1 infections are polymicrobial and involve a non-group A streptococci. Type 2 infections of NF are developed by group A streptococcus bacteria. These bacteria are the cause of many illnesses such as strep throat, scarlet fever, skin infections, and rheumatic fever. Group A streptococcus is thought to be the most common cause for necrotizing fasciitis. These gram-positive bacteria are commonly carried by humans in our noses, throats, and skin without showing any symptoms. When group A strep causes NF, It can occur together with streptococcal toxic shock syndrome, which accelerates the speed and deadliness of the infection. Staphylococcus aureus bacteria is also becoming a more common cause of NF. Similar to strep, these gram-positive bacteria are commonly carried by humans on our skin or noses without showing any symptoms. Staph bacteria can cause boils and food poisoning. These bacteria or bacterium enter into the body either through an external injury, like surgical sites, a cut, a scratch, bruise, or boil, or any small injury, or direct spread from punctured, perforated internal organs or sexual organs. Upon infection, the bacteria or bacterium spreads through the fascia, producing endotoxins, which are toxins that are released as the bacteria die and break apart or are lysed, and exotoxins, toxins which are released by bacteria as waste. These toxins restrict blood supply to the tissue, which is called tissue ischemia. Because blood supply to the tissue becomes impaired, neither antibiotics nor the body's own mechanisms can fight the infection that reach these tissues. As such, treatment requires surgical removal of dead and infected tissue.
Hi, my name is Tasha Tingy, and I'm going to talk about signs and symptoms of necrotizing fasciitis. So we'll start off the beginning stages. There will be a red or swollen area of the skin that spreads quickly. They'll be accompanied with severe pain, including pain that goes beyond the area of the skin that is red or swollen. You'll have a fever, and overlaying skin may appear shiny, like you can see in this picture. The initial skin changes are very similar to cellulitis or an abscess, so it can be easily misdiagnosed. These are the later stages. I couldn't help but get the gnarliest pictures I could find. So these later stages are going to include ulcers, blisters, or black spots on the skin, like you can see in this top picture. We have pus or oozing from the infected area, formation of bullae, bleeding into the skin, presence of gas in tissues, and reduced or absent sensation of over the skin, and this is due to necrosis of the nerves underneath. You also have dizziness, fatigue, shock, diarrhea, or nausea, and these symptoms can go from minor to extremely bad really quick within like 24 hours. So it's incredibly important that you get treated as quickly as you can, which we'll talk about next. So what to do if you do show these signs. The first thing is just go to the ER immediately. Because this infection can happen so quickly, they'll actually often start treatment before you actually receive an official diagnosis. That way they can get ahead of it. And then how they come to a diagnosis is that they're going to take a tissue sample and they'll do a biopsy. And they'll also do a blood workup and look for any signs of infection or muscle damage. And then they'll do imaging of the infected area. So next, I just want to share a true story and to show an example of the signs and symptoms and how quickly they can go from minor symptoms to life-threatening. So this is a real true story of a woman named Karen. She was treated at Memorial Hermann, and she went to the ER with a throbbing pain in her left arm and flu-like symptoms. She originally just thought she had a cold, and she ended up going to the ER because the pain in her arm was getting so bad. They ran tests in the ER, but everything was coming back just fine. But thankfully, they admitted her for observation anyways. So shortly after moving out to her hospital room, her husband noticed a rash on her shoulder, and this rash hadn't even presented itself in the ER. And so the doctor noticed cellulitis along her shoulder, arm, and back. And this was the first big sign of necrotizing fasciitis. Her overall health at this point was declining very rapidly. As soon as she was diagnosed, Karen went on to have surgery and ended up being okay. But as soon as So as you can see from this example, the signs and symptoms aren't always very clear and can be misdiagnosed. And they can also be in different orders, with the pain coming first and the rash coming later. But these, and you can see here as well, I mean, the symptoms and signs can spread very rapidly and can get worse very quickly and become very life-threatening. So these are the signs and symptoms of necrotizing fasciitis.
My name is Ian Yunt, and I will be discussing prevention and treatment of necrotizing fasciitis. There are a few main ways that necrotizing fasciitis can be prevented, but there is no surefire method that will prevent one from getting this disease, most of which may be extremely obvious. First and foremost, good hygiene is on the list of preventative measures to avoid getting this disease. This should include, for every individual who is able, a daily shower or bath, and washing hands with soap and water frequently. Second is to clean and care for wounds that one sustains, no matter the severity. Though this may seem just as obvious to everyone as the first step, many times we think, oh, it is just a little cut, it will be fine. Even though this disease is rare, and we must take care of even the littlest of cuts in order to prevent getting this disease, wounds should be promptly cleaned with soap and water, and if possible, cleaned with an antiseptic, dressed with bandages, allowed time to drain, and keep the bandages clean until the wound has healed. For more serious wounds, medical attention should be sought. There are many different ways to treat necrotizing fasciitis, and the type of treatment that is used relies heavily on the stage the disease is at when treatment begins. Those listed here are not the only treatment methods. A few others include medication to raise blood pressure, cardiac monitoring and breathing aids, hyperbaric oxygen therapy, intravenous immunoglobulin therapy, and blood transfusions. The first lines of defense typically are antibiotics and surgery. Hyperbaric oxygen therapy and intravenous immunoglobulin therapy are not commonly used as their effectiveness has not been proven in large-scale clinical trials. Though this may seem extreme, surgery is typically one of the first treatments. This is used to surgically remove the damaged tissue. This is obviously used in conjunction with antibiotics. Since the antibiotics cannot enter into the already dead skin, surgical removal is necessary. This allows the healthy tissue to better heal. On average, 3 surgeries are necessary, spaced 12 to 36 hours apart to best control the infection. 3 is not the magic number of surgeries. This can be more or less depending on the severity of the disease. This can at times lead to lots of tissue, entire groups of muscles, or even limbs being removed in order to control and remove the already dead tissue from the body. After surgery, the wound should be left open and treated with wet to dry wrappings after the disease is contained, and no more surgeries are necessary. Skin grafts or plastic surgery can be necessary to close the wound fully. The amount of surgery is completely dependent on the progression of the disease and the time at which treatment starts. If the disease is caught in its early stages, it can be treated with antibiotics. Antibiotics are important in order to control the disease and prevent further spread.
Hi, I'm Michael Barrera, and I will be reporting on the interesting facts about this disease. Necrotizing fasciitis has had a good amount of media coverage. The mere fact that it eats your flesh brings horror to most. Necrotizing fasciitis has even had its 15 minutes of fame in Hollywood in the horror film Cabin Fever. Remember that most cases of necrotizing fasciitis begin as an existing infection on an extremity or in a wound. However, a true story about necrotizing fasciitis recently caught media attention in 2017.
Wayne Atkins taking some of his first steps at the University of Miami Hospital more than a month after his family says a hike in the White Mountains took a near deadly turn, all from something that at first seemed so mundane.
Hiker Wayne Atkins trekked up Mount Garfield in New Hampshire, a staggering 10-mile round trip. His blisters are a common hiker side effect. Thinking nothing of it, he attended his family member's wedding and returned to his home city of Miami. However, his blisters were not healing and his overall health plummeted. After visiting the hospital, doctors informed him of his prognosis, necrotizing fasciitis. He would spend the next month in the hospital being eaten by this bacteria. Atkins did not know that the blisters opened a door for a group of streptococcus to walk right in. Also, what Atkins didn't know is that acquiring the bacteria through blisters, as Atkins did, is very rare. About a 1 in 250,000 chance. Atkins had a higher chance of getting struck by lightning, which is 1 in 3,000. So the fact that he got necrotizing fasciitis through blisters is jaw-dropping. Once doctors realized what disease they were facing, Atkins was facing liver and kidney failure. He also acquired respiratory distress syndrome. Today, Atkins can still walk. He still has the use of both legs, although a large chunk of dermatitis were removed. Never rule out necrotizing fasciitis, even in the most unlikely situation. It spreads quickly and should be taken very seriously.